Today I wanted to take some time to talk about Kendall Jenner because I get a lot of questions about her. She's obviously very attractive, and has she had work done? What's been done? How can you look like her? Or what type of procedures would achieve results that she has? And I think there's some obvious things and then some not so obvious things. If you're looking at her difference here from a little bit younger to a little bit older, there's some changes that are pretty obvious. One, right out of the gates, her skin. And some of that may be just maturation and losing some of the acne and better skin care. And I think that shouldn't be overlooked because skin is the first thing everybody's going to see. And you can see that her skin is much more flawless, more beautiful here than it was when she was a little bit younger. And that has, like I said, probably something to do with getting a little bit more mature as well as a good just daily skincare routine.
She had a brand deal with Proactive. Do you think that that's really what changed her skin?
Probably helped. I mean, any sort of acne sort of intervention is going to help not only the appearance then, but the future. What people don't realize with bad acne is that you get scarring, pitting, problems with the skin that can last a long time. They're very difficult to correct. So taking a proactive or preventative stance, skincare is good because, you want to prevent those long-term problems with the skin. So I think that that's a smart thing that people can do right out of the gate, looking better, skincare routine, preventing the acne. If we look at her brow position, we can notice that it has changed as she's gotten a little older. Some of it can be natural, but some of it's probably not, and that probably has a combination of something to do with Botox and or threading. So if we're looking at the brow muscles, they affect expression and the location of the brow. So if we weaken the muscles up here, the brow will drop. If we weaken the muscles here, the brows will raise or it will come up more elevated, as well as if we weaken here. So she probably has Botox up here in the brow and not here, so that her brow is more slanted this way, as well as the tail is lifted, so maybe a touch here and or a thread that's pulling this up. And I think that's a very pretty look. A lot of people want that Bella Hadid look, that slanted eyebrow look, and you can get a lot of that non-surgically now with Botox and or fillers and no scars. Next, if we're looking, I think two things that stand out to me is her nose and her lips. In her nose, we can see that it's been refined. In other words, the bridge is more narrow, the tip is more narrow. It's just overall a little bit more aesthetically pleasing. So very suspicious for a rhinoplasty at some point. And it was done very well. It's very natural. There isn't anything about it that makes it look overdone. So I think that this was an improvement to her overall balance and aesthetics. And then lastly is her lips. I've said before, obviously our lips don't get bigger on their own. They don't get bigger as we get older. They'll generally get thinner, and we can see that her lips have gotten thicker and more full, so she's definitely probably had some fillers or some sort of injections into her lips. I think, again, it was done respectfully. It's not overdone. She's not all ducky or big giant lips that are too big for the rest of her features, because, again, that'll throw everything off. So I think it was done respectfully, and I think it's a very pretty look and very balanced look. So overall, I think it's not a look that is one of the ones that people come in asking for that is bad. I think that if they come in asking to look like Kendall, it's a positive thing because it means they want something natural and something that's very beautiful. When talking about Kendall, I think it's important to mention something called aesthetic sense. And I think in regards to her, what aesthetic sense is not sixth sense. That's like being psychic or seeing dead people. Aesthetic sense is your sense of beauty, what you think personally is beautiful. And everybody has their own, kind of unique aesthetic sense. And I think that's why I personally think it's a good idea for patients to bring in photos of people they like, whether, be the Kardashians or Jenner or any of the even older, more famous people, Marilyn Monroe, classic timeless beauties, Cindy Crawford, Angelina Jolie, women that have beautiful proportions and overall their aesthetic sense or look is very attractive. And the important thing with that is to make sure that your aesthetic sense and your surgeon's aesthetic sense are matching, or you have a discussion about it, because Kendall Jenner's nose may not work on everybody, or her lips may not work on everybody, so you have to match it to your own face and your own aesthetic sense. And more importantly is to not let your surgeon's ego get in the way of that. In other words, you want to go to a surgeon that's going to listen to you and hear what you want, your concerns, your desires, so that you get a result that you're happy with, because you have to live with that on your face. So when patients come in telling me that surgeons have said they're going to do what they want to do and they didn't listen to them, that's a slippery slope, and that's somewhere you can end up with something you didn't want. So I personally think that when you talk to your surgeon, you should bring in photos. You should bring in examples of what you like. And then lastly, I think it's also important to take advantage of modern technology, because there are now computer simulations, software where we can image things, morph things, show you what Kendall Jenner's nose would look like on your own face. And again, that's something you want to see and then say, well, I do like that, or actually I'd like to see it a little different than that. And then once you find something where you both are like, that's beautiful, I love that, then you go ahead and do the surgery. And I think in the end, that'll make you much more happy, and the results will be very natural and very aesthetically pleasing.
So do you think she's the prettiest Kardashian Jenner?
No, what's the other one? I don't know if I'd say one's more beautiful than the other, and that's not a political answer. It's just that, similarly speaking, I think that they all have different features. So who's the most perfect or the most beautiful? You know, I prefer more natural look, so I do think Kendall has a very natural kind of beauty to her, so I do like that. In reality, no pun intended, that they are good examples. You know, I think she is a good example of something that's beautiful, but what I don't like is when patients come in saying they want to be Kendall Jenner, they want to look exactly like that, or Bella Hadid, and they want the exact eyebrows and this, because it may not work on them. So that was what would annoy me more than saying I want to look like them versus I want to look exactly like them, because that's probably not a smart thing to do. But overall now, I think I've settled in that it's okay. I think there's a lot of examples of very beautiful people, so I think it's slightly narrow-minded to only bring in those same people over and over and over again. And so I like when patients explore a little bit and bring in, you know, many different types of faces, many different noses, slight variations. I like this on that nose or this on this face, and instead of just the same person all the time.
People had questions about this video. Where would they leave their questions?
Below. They leave them below.
That's right.
Is it down there somewhere?
So down there.
I hope you enjoyed this segment on Kendall Jenner. If you have any questions, please leave them in the comments below.